Well, thank you very much for that introduction, and thank you everyone for joining us this evening. This is going to be an overview of not every single alternative therapy for pain management, but it's going to be an overview of all the ones that I have either personally used or have seen used in practice on patients that I have helped my colleagues out with. So how about we just dive right in? So the goal of pain management in companion animals is aimed at improving quality of life by controlling pain and restoring mobility to the greatest extent possible. And sometimes this means just letting, Fluffy go for maybe not a 3-mile walk, but a 3-block walk, them being able to get up from a laying and sitting position on their own to, to be able to go outside and eliminate, or just go outside and, smell the grass and look at the squirrels. Some traditional modalities for accomplishing these goals include dietary manipulation, physical therapy, like underwater treadmill, Calvetti exercises, surgery, and pharmaceutical agents, non-steroidal anti-inflammatory drugs, corticosteroids, and nutraceuticals, as well as medications like gabapentin, pregabalin, amantadine. This presentation will give a brief overview of some alternative modalities that can be used for primary or adjunctive pain management due to arthritis and osteoarthritis. So let's first talk about the clinical signs of pain. Most owners really don't understand what pain is, or actually how their pets express pain. Most say to me, well, we still eat, we still drink, and, we still go outside to go to the bathroom. Meanwhile, Fluffy is limping or dragging a leg, or winces when you go to pet them on the head or the neck. So I always like to discuss, the clinical signs of pain with my pet parents. So first, we're going to see antisocial or even aggressive behavior, signs of agitation, restlessness, they can't sleep at night, changes in physical appearance and posture. So, altered head carriage, hunched position. Some of the obvious ones are, limps, or we'll even see them sort of dragging a limb if the osteoarthritis has progressed to the point where we have proprioceptive deficits. So I've kind of already said this: mobility issues and limping, shaking and or trembling, excessive grooming, because we know excessive grooming can either be, at the location of where the pain is, or somewhere else on their body. That's just kind of a soothing or a calming behavior for themselves to kind of help them forget about all the pain that they're in. So excessive panting and changes in breathing, increased vocalization, vocalizing when they get down, crying out when somebody goes to pet them, decreases in appetite, and altered sleeping patterns. I was just speaking to a client today that wasn't sure if his dog was in pain or not. And he didn't show a lot of the other signs of pain, but he said, he's really restless at night. He's not sleeping as well. And then upon an examination, we kind of were able to figure out that we actually had some cervical pain, and that's why this dog could not get comfortable at night and was constantly shifting around. So let's talk about nutrition first. So evaluating a patient's diet is an important first step to managing pain. Obesity increases the load on joints, in turn increasing the risk of developing joint disease, the speed of disease progression, and patient discomfort. We know that white fat is not inert. There was a study done a few years ago basically showing that white fat expresses a hormone that actually damages cartilage. So, we all have those clients that love a little extra weight or think a chubby dog is cute. But I often, warn them even well before we start exhibiting signs of pain that we're going to have to pay on these dividends of the cute chubbiness, and reducing their weight is just super, super important. And also, if we're going to try to mitigate pain, but we're not going to try to, if we're going to try to mitigate pain and not have them lose weight, we're kind of setting up, walls for our own success. So again, I always talk about weight loss when appropriate. So according to Banfield's 2019 State of the Pet Health Report, 52% of dogs and 41% of cats with osteoarthritis cared for in 2018 at Banfield practices were obese. Results of a lifelong study of 48 Labrador retrievers show that restricted feeding versus feeding them ad libitum delayed or prevented the development of radiographic signs of osteoarthritis, because these dogs were kept at a good, healthy body condition score, and they were not allowed to gain that excess white fat that I was just talking about. So there are several therapeutic diets available to aid in weight control as well as pain management. Without naming them, I'm sure everybody out there knows. A few companies out there that do have weight control and mobility diets. These diets are often lower in calories than your typical diets, and contain high levels of omega-3 fatty acids, which help support joint health and mobility by reducing inflammation, as well as glucosamine and chondroitin, which help slow cartilage deterioration. So this is obviously in my wheelhouse, traditional Chinese veterinary medicine. And before we do anything as TCVM practitioners, we're always performing a pattern diagnosis, because in Chinese medicine, there are a lot of causes for osteoarthritis and osteoarthritic pain. So if we're going to treat them, we need to develop this pattern diagnosis. So we use the right acupuncture points, and so that we're using the right herbs and also the right foods in food therapy. So pain is understood as the invasion of wind or damp or cold, as well as the stagnation of blood and qi in the body. And the diagnosis is discovered by identifying the underlying pattern of disharmony. Our pattern diagnosis differs from conventional Western medicine diagnosis by considering not only the disease signs, but how these signs relate to the individual patient. So we're not going to just blanket, give an NSAID or give something like pregabalin or amantadine. We're actually going to work up a pattern diagnosis, and in working up that pattern diagnosis, we consider the temperament, the pulses, appearance of the tongue, sex, age, activity, and environment, along with the patient's individual disease signs. Age and location are very critical for us, as well as pulses and the appearance of the tongue. This approach originates from a belief that the body is an interconnected system of forces, energies, and functions. Therefore, disharmony must be examined with respect to the whole patient. So we're not just going to focus on the front right leg that we're limping on. We're going to look at the whole entire body, check to see if there is pain coming from anywhere else, thoracic region, lumbar region, sacral region. Oftentimes, the leg that they're obviously limping on isn't the full problem. It's potentially, the contralateral hind leg, or the opposite front leg. So we really, it's important as TCVM practitioners and just as practitioners in general to take a whole body or a whole pet approach when we're isolating pain and treating it. So acupuncture is one of the most common modalities that I use. It's a form of traditional Chinese medicine that's performed by introducing thin, specialized needles into acupoints. The use of acupuncture for the treatment of pain has become more common in general practice in recent years and is often requested by clients as an alternative to pharmaceuticals. Now, these acupoints have been mapped out for thousands of years. The first actual historical record of this was the Shapley, which was published, I believe, in 1100 BCE, and it discussed internal medicine, it discussed acupuncture, it discussed herbal remedies, food therapy, and actually is one of the first documented medical treatises that discuss veterinary medicine. Now, of course, back then they were more concerned with their horses and oxen because that was their car and their tractor. But eventually, over the years, it started to blend in or start to bridge over to companion animals. So if dry needling doesn't work out, if the patient is a little too mobile, or I've had some cats try to take fingers from me, and some dogs too, with trying to just dry needle them, we can utilize acupuncture, and this is the introduction of sterile fluid into an acupoint as an alternative to setting dry needles. So if we have, and this is again where pattern diagnosis is important, if we have an invasion of cold and dryness, I'm going to utilize B12 because B12 we know is warming. If we have a heat condition where it's more of an acute injury, we're not going to use that B12. We're not going to infuse more heat into that acute injury, that excess. We're going to use something like sterile saline, which is more neutral or more cooling. Moxibustion, this incorporates a burning of moxa, which is just small cones of dried herbs, to apply heat safely to acupoints. So again, we're going to use this in those cold patterns. We do have flameless, smokeless moxa, and obviously we always worry about thermal burns or even singeing hair. So it does take some training to use moxa to kind of avoid any injuries to the pet. We have electroacupuncture, which combines mechanical and electrical effects, commonly used to relieve pain associated with joint disease. The concept in Chinese medicine with electroacupuncture is we're breaking up stagnation. So I tend to use these when I have developed a pattern or designed a differential pattern diagnosis, and I feel that we have blood and qi stagnation. The electroacupuncture is really great at breaking up that blood and qi stagnation, and also use it a lot of times when we have those CP deficits or there's a neuropathy involved with the osteoarthritis, because it really helps to kind of jumpstart the nervous system. It retrains the nerves so they get back that proprioception. And then we have laser acupuncture. Involves the use of a low intensity laser to stimulate the acupoints. This is slightly different from the class 4 laser, which I'll be bringing up a little bit later. And then, of course, I love to use herbal formulations, and I feel that they're best in combination with acupuncture. They go hand in hand with one another, and I have seen a lot of improvement once starting acupuncture. And if we're not quite getting where we want to, as far as relieving pain or increasing mobility, I'll always add herbal formulations in. And they are, made of or comprised of just plants that are often harvested. Some in China, some are grown here. So we have herbs in, let's say, we're using concentrated dox formula in this example. So we have morinda, which tonifies kidney yang and strengthens bones. We have fennel, which warms the back and relieves pain. Dong Guai, which invigorates blood and relieves pain. Asian water plantain drains damp and benefits the bladder. So these herbs work, again, in combination with the acupuncture, but to pick out the right herbs and the right acupuncture prescription, again, we go back to the importance of that pattern diagnosis. So this is becoming more and more popular, cannabinoids. We know that there's a lot of commercially available CBD formulations and product types. So they come in treats, oils, capsules. There are full spectrum formulas, and they've been shown to be the most effective. There are isolates, broad spectrum and full spectrum. Again, the isolates and the broad spectrum do have their benefits, but I find that the full spectrum formulas that have all the terpenes in there, they have they're less processed. There is some THC in there, but not THC delta 9 that causes that psychotropic effect. But when picking out a CBD product for our patients, third-party analysis and a certificate of analysis are critical. Sourcing and purity, again, are also critical for safe and effective product selection. So research on the use of cannabinoids in veterinary medicine and the endocannabinoid system as a whole is flourishing. There's still a lot of research going on. We understand a lot, but we don't know everything. And I'm constantly, going on forums and trying to learn whatever the newest research was. And if you're going to responsibly recommend, it depends on what state you're in. I'm in New Jersey. I can't prescribe CBD products, but I can definitely have a conversation with owners about it, the benefits and where they can purchase it from. But to do that, you need to be up to date on all of the research, and there is research coming out daily. So cannabinoids are being studied for their ability to treat pain and inflammation in osteoarthritis patients. In a study published in April of 2021, CBD was shown to induce broad anti-inflammatory effects in vivo and to greatly reduce inflammatory tumor necrosis factor alpha in vitro. And I firmly believe with further research, this could be, it is a viable treatment option, but I feel like it's going to be something that is going to be more readily available to us as practitioners. A lot of the stigma is starting to kind of dissipate, and my hope is one day every state in the country will be able to carry CBD products and prescribe them to our patients, so that our clients don't have to go to third-party sources. MICROLACTIN, another great modality. MICROLACTIN is comprised solely of milk proteins extracted from bovine milk. It's acquired by giving lactating cows immunostimulants, which produces a larger number of antibodies in the secreted milk. Strengthens the integrity of the barrier-like wall of cells that line blood vessels, preventing fluid from leaking from the blood into tissue at sites of chronic inflammation, and inhibits excessive swelling. What I love about MICROLACTIN, it can be used in combination with NSAIDs, steroids, herbal formulations, acupuncture, CBD is very safe to add in. And I remember when it very first became available to veterinarians, I was a little skeptical about it. And the more I used it over the years in combination with other treatments, I've just been amazed at how much it can help the pet just turn the corner on their pain. Stem cells, this modality is also becoming more common in small animal medicine. I think it's always been there, but I think it's actually not only is it becoming more common, but it's also becoming more affordable and more readily available. And it has great ability to improve the mobility and the quality of life in dogs with osteoarthritis. There are commercially available autologous adipose-derived mesenchymal cells that have been used by veterinarians for over almost more than 20 years to treat joint disease as well as tendon and ligament injuries in horses. In a 2007 study, dogs with hip OA treated with stem cells showed significant improvement in mobility and pain scores. I have seen clients who have stem cells used for elbows, knees, hips, and again, it's another great modality that helps a lot of our patients turn the corner and get their pain better managed. We also have platelet-rich plasma cells. It's a form of alternative regenerative medicine used to treat inflammatory conditions of the ligaments, muscles, and tendons, inflammation that we see in osteoarthritis. It's derived from removing red blood cells from whole blood of the patient, then isolating the platelets through centrifugation. The platelets contain cytokines and growth factors that are the basis of PRP. Growth factors attract macrophages, which engulf the pathogen, as well as activating fibroblasts and endothelial cells to help, again, reduce inflammation, help heal and repair those muscles, tendons, and ligaments. We also have monoclonal antibodies that are coming out. In a 2014 and 2019 study, the anti-nerve growth factor monoclonal antibodies were used against nerve growth factor in canines and felines to alleviate pain associated with osteoarthritis. The nerve growth factor and its interaction with tropomyosin receptor kinase A was found to play a key role in nociception and nervous system plasticity in pain conditions. Evidence from these studies indicates that anti-NGF monoclonal antibody therapy has positive analgesic effects and is well tolerated for up to 3 months in dogs and cats suffering from arthritic and osteoarthritic associated pain. So this isn't going to necessarily repair anything, but it is going to alleviate that pain. We have Synovitin OA that is out now. This is targeted therapy. It's TIN 117, which is a novel radioisotope. Reduces synovitis and relieves chronic canine elbow pain. It targets the pro-inflammatory macrophages. It's very long-lasting, up to 1 year with only 1 injection. Just once a year, if even needed. There's no systemic or local side effects. It's a veterinary device. It's not considered a drug. It's minimally invasive and it's an outpatient procedure, and it's also multimodal, so we can use it with other treatment types. I know everybody always gets nervous when they hear radioisotopes. The dog receiving this needs to be done in a facility, kind of where we do that has a setup for radioiodine therapy for your hyperthyroid cats. but they are not exuding radiation. It's actually less radiation than the normal background radiation that we experience. And we just the patient is held in the facility for the day, monitored, and can go home. One thing that's super important with this is if there is pain in one elbow, it's very, very important. And if there and radiographic signs of osteoarthritis in one elbow, it's super, super important to check the other elbow too. Because if you treat only one elbow, you have to wait a whole year before being able to treat the other elbow. So that's kind of the only drawback to it. So again, it's just a matter of doing due diligence and making sure that you're evaluating both elbows. And if you're going to treat one elbow, you might want to know if you have to treat the other one instead of course, making the patient wait a whole nother year. There's the class 4 laser therapy, which I use a lot in combination with acupuncture and herbs. It's part of my trifecta. So it utilizes focused light to increase blood circulation and stimulate the regeneration of cells. It's a non-invasive and drug-free treatment used to treat inflammatory conditions. Some pets exhibit greater comfort and mobility within 12 to 24 hours after a single laser treatment. Class 4 laser therapy treatments are cumulative in nature, meaning they gain cumulative effects. They seem to respond better and better to the more laser treatments that they have. And of course, this is patient-centered treatment, so the length and frequency of treatment varies with the patient's condition. So you can't guarantee that Fluffy will be better in 5 treatments. Fluffy might be better in 3 treatments, or it might be better in 7 treatments. All depends on the patient. Then we have pulse electromagnetic field technology. This type of therapy is another form of non-invasive, non-thermal treatment modality that has been widely studied and utilized for nearly a century. Pulse electromagnetic field therapy has been approved for use by the FDA in both human and veterinary medicine. If I remember correctly, I think it was approved in human medicine by the FDA like 100 years ago. And that's no exaggeration. So devices like the CC loop have been shown to reduce the pain and inflammation associated with arthritis and osteoarthritis in clinical settings. So the CC loop consists of a single loop antenna and battery-powered pulse generator used to treat an area of soft tissue on a patient. Research studies focused on a mechanism of action have demonstrated that targeted pulse electromagnetic fields induces downstream production of nitric oxide, one of the few known gaseous signaling molecules. So what's the significance of the nitric oxide? Nitric oxide is a potent vasodilator and can potentially influence cells of the immune system and the nervous system. So targeted pulse electromagnetic field treatment has been shown to result in production of low concentrations of nitric oxide, which are associated with diminished inflammation and enhancement of vasodilation. So we know if we reduce inflammation, we do reduce pain. If we increase vasodilation, we know that we're going to be able to get those damaged cells out and the repair team in. And again, using this modality, I've recommended to a lot of patients that or clients that want to do something at home for their pets, and we've had a lot of success. And I've actually been recommending it more, as well as doing at-home laser therapy. There are what I call civilian lasers that can be bought. So oftentimes it's just a matter of convenience for the owner. But again, the CC loop have had a lot of success with and a lot of great feedback. So in conclusion, the prevalence of osteoarthritis combined with a shift in client perceptions and the desire to treat with alternative modalities poses a unique challenge for veterinarians. Pets are living longer. We're dealing with a lot more arthritis. People are starting to have, well, now that we're out of lockdown, people are getting back to very active lifestyles and bringing their pets along. Of course, not realizing that their pets have aged significantly during that time. But it is now possible to safely and effectively improve the quality of life in these patients when surgery and pharmaceuticals are not an option. One of the things I always say is motion is lotion. We want to lightly exercise our osteoarthritis patients. Helps in reducing weight, lubricates the joints, strengthens muscles, and strengthens the muscles that support joints. The modality selected should be tailored to the patient's specific needs and the owner's ability to remain consistent in their role as a caregiver. So if you have a client that can't come in for laser therapy, then you can recommend the Assisi loop to go home. If you have a client that, can't commit to acupuncture weekly or every other week, and they don't want to do any pharmaceuticals, well, then there are herbals that can be combined with MICROLACTIN, that can be combined with laser, that can be combined with the Assisi loop. So I tailor all of my osteoarthritis treatments to the client and as well as the patient needs, just to get the best possible outcome. I've included my references if anybody's interested in diving in a little deeper themselves. And that concludes the presentation. Thank you everyone for joining, and we'll take some questions.